Hi, my name is Aristotle.
I'm James. Nice to meet you.
Hey, nice to meet you. So yeah, I was a night shift nurse. So I'm a CCB student nurse. So I was working on the med surg floor today in 3 West. The date today is 03/01/17. The patient I was taking care of today was initial CB, room 274. His admission date was 02/27/17. He's currently an 82-year-old male. The reason why he came here is because he had shortness of breath, so they brought him over. He's currently full code. His attending physician is Dr. Carbonell. His primary contact is his son. So, like I said, the diagnosis was CHF, and he also had a GI bleed along with that. He speaks English, so you're going to be able to communicate with him. His patient history, he had hypertension, chronic kidney disease, chronic heart failure, and arthritis. His home meds are currently aspirin, Plavix, and losartan. He was a former smoker, but he quit in the 80s, so he should be suffering no symptoms from that right now. His allergies are penicillins and sulfa. So while I did my assessment, I did it at 4 a.m. His blood pressure was 130/82, heart rate 64, respirations 15, temperature 98.6, O2 sat was 96%, and he had 4 liters per minute of oxygen per nasal cannula. He currently was suffering no pain. He had a 18 gauge in the left AC, and it was running magnesium sulfate through that, 25 milliliters per hour. His abnormal labs, he had some low RBCs at 3, low hemoglobin at 8.7, low hematocrit at 26, and low platelets at 109. So there's definitely evidence that there is a GI bleed going on. He's ANO times 4. He has bed rest. He's on bed rest right now. He has an irregular heartbeat, and when I assessed it, it looked like he had AFib. So right now he's currently on NPO. He's going to be receiving an EGD procedure later today. So make sure to hold his Plavix, because it's going to make him bleed out if you give that to him. For his genitourinary system, he had 1,400 milliliters of urinary output. His skin, when I assessed him, he ended up having a stage 2 pressure ulcer on his right buttock. So make sure to just clean the dressing and monitor for any further lesions. His skin was his skin was brittle because he had low calcium. So just make sure to keep monitoring that calcium as well. There was no one at the bedside, so just keep a close eye on him. Lastly, for his goals, just monitor his red blood cells, his platelets, his hemoglobin, and his hematocrit, so that we can prevent any more bleeding from going on. Keep his oxygen at 4 liters per minute till we're able to wean him off of that. He's going to have EGD later, like I said, so just hold the Plavix, make sure that happens. And his magnesium sulfate was replaced at 6 a.m. today because he had low magnesium, so just, if needed, just replace it at the same time tomorrow. For his discharge teaching, just teach him about all of his diseases. He's got a lot going on, like CHF, hypertension, chronic kidney disease, and it's affecting a lot of his body, so we need to make sure he's informed. And just tell him to conserve energy and just save his skin because it's pretty brittle right now. For error prevention, there's a high fall risk, so make sure to put the bed alarm on and turn him every 2 hours. And that's it. Just monitor him every single 2 hours so that you know what's going on. Is there any questions?
No, that sounds pretty good.
Awesome.
Yeah.
Awesome. Sounds good. Well, I appreciate talking to you. I'll see you tomorrow.
Yeah, see you.